Certainly we're paying attention to it as things started to happen in late January, mid-January. I think we made some early decisions that if we could get a group of people willing to do the work, that we had to stay open.
The last 6 months or so have been like no other before. We felt like we cannot do the work that we do.
How do we deal with this?
Ultimately, we want to be safe. We want to make sure that the children are cared for, and they're cared for by this amazing group of staff.
It's been a challenge, but I'm really proud that we've been one of the only organizations to really remain open throughout this and continue to support the children and families.
The center's been open continuously 24 hours a day, every day, for 45 years. It's never shut down. Now that is a tremendous amount of responsibility. You throw in a global pandemic, it's a pretty tough mix.
I feel like NECC has really handled this in an appropriate way and has really kept safety as the top priority.
We felt like, oh, we cannot do the work that we do. This has taught us was that, you know what? We can manage or design our staffing in a way that would allow us to still continue doing what we do.
We made a decision that if the staff was willing to work through this, well, we'd keep the program open. We knew, and the Commonwealth of Massachusetts knew, that there was nowhere for our more challenging residential kids to go.
Quickly at the beginning of this crisis, we formed what we call our emergency management team. We've been working together since March, developing protocols, addressing concerns, answering questions, consulting with experts. It's been nice to have a group like that who is working so well with each other, because nobody can manage this all by themselves. The nurses, the nurse practitioners, our providers, our administrative specialists, assistants have adapted in ensuring that we still provide the same care. They were able to provide us protective equipment that the nurses can still go in the houses, still assess the kids. Our food services staff quickly shifted to, instead of a cafeteria setting where they were serving hundreds of kids a day and staff, to a delivery service where they were cooking all of that food every day. And then we quickly had different people from different departments volunteer, so to speak, to take on this new role of organizing a delivery structure so that we could deliver food to 16 different locations. There's just so many examples over and over again of departments across the school who did everything they could to keep things going.
You know, we had to close the day program. That was basically ordered by the state. Parents had to give up seeing their kids for what turned out to be 4 or 5 months. Everyone had to agree on a certain set of procedures and discipline. We learned, I think, a lot. We did have cases. We did contain them. We have cases today that we're working on. This pandemic is not over. We have the testing we need. We have a lot of know-how. We had the staff discipline and support. The folks who take care of our facilities are constantly cleaning, spraying, managing ventilation, and we've just done everything we can to contain and limit the spread of the virus. And it's just really hard on everyone.
The fact that we were able to leave our daughter in a residence for several months without seeing her, I don't think I could have had that happen had it not been for NECC. There's a lot of things that the school put in place for the teachers to help them continue their job in a safe way. The fact that the school was able to roll into a different mode of teaching in the speed at which they did it, trying to provide individualized plans for everybody, and I feel my kids made progress. I don't feel that there was any regression. There's been many moments like that where the school has just really been super involved in how we can make this better for them. You know, how can we make them thrive?
Zoom has kind of made it a little bit more accessible for some teams that might have transitional behaviors. Whereas, you don't have to take the 2-minute walk down to the music room. You just click Zoom and it opens, and here's Miss Nadia. I learned a lot of, it's gonna be okay. No matter what happens, if the Wi-Fi goes out, if they can't hear me, if I can't hear them, just being patient and being accepting of whatever is coming out of it.
I think we learned that what we do as special educators, as behavior analysts, as part of our autism community is more critical than it ever was. This has clearly been very challenging in learning how to provide those services in totally different ways, and maybe teaching those same skills but with a special emphasis on safety and supporting the family.
Sway, 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 come my friends and gather round so we can sing. It's been interesting to see how many students are doing so well with remote learning given all of the difficulties this year has brought. I've had a lot of success with students that haven't been coming to music now coming to music regularly, students that don't usually sing are now singing, students that had a hard time matching and working on different movements have started to show progress in focusing on those movements. The students are getting to still have music even though, we're still kind of in a weird time. I know that other schools have canceled music, so it's really been nice to keep music and to keep this fun time and to continue working on leisure skills, continue to working on education. I want them to have fun. When a song comes on, I want them to feel happy. I want them to think about times that we've had in music. I'm focusing more on them being who they are and being able to connect. I love it. It's like part of my identity, I guess, being a music teacher.
Come on in, Luke and John.
Happy Friday.
Happy Friday, Luke.